The following segment is sponsored by Oakview-Medical-Associates.
High blood pressure or hypertension can go unnoticed for years, and if it's not managed, it leads to heart problems. Dr. Nita Bajor from Oakview Medical Associates is here. Good morning, Dr. Nita.
Good morning.
First, we strive for a healthier lifestyle these days, and you say we need to be really conscious of our blood pressure, right? How important is that?
You know, hypertension or high blood pressure is actually the #1 cause of a lot of other chronic problems like heart disease, strokes, and even death. So it's something that we really need to be very aware of and need to know how to manage it better, need to be aware of what medications work. It's a pretty important topic.
Well, you shared an interesting slide, I thought, about the prevalence of hypertension in different states. We'll put that up now. South Carolina is in the darkest red.
Yes, South Carolina has one of the higher prevalence groups in the United States. Hypertension, normal blood pressure is under 120 over 80. Between 120 to 129 or 80 to 85 is something where we need to start paying attention to that blood pressure, and certainly talk to your doctors and have a management plan in place. There's also a lot of differences in terms of ethnicity, age groups, gender, in terms of managing diabetes, high blood pressure. So it's really important to be aware. The CDC has some good information on the different risk factors out there. And in fact, a lot of diabetics have high blood pressure too. 1 in every 6 diabetic patients ends up needing blood pressure medication as well.
An issue we all need to be aware of. Talk possible causes now of hypertension. I know they include things like stress, obesity, too much salt, excessive alcohol consumption, smoking, tobacco, even lack of sleep. So a lot of these are dependent on lifestyle, right? A
lot of the causes of high blood pressure are dependent on lifestyle. Yes, there are essentially 2 causes. One is known as essential hypertension, which just happens because of, as we age, the stiffness in the blood vessels. And then the younger age group, actually children and adolescents also get it. That's more, there's some genetic causes of that. Also kidney disease, certain infections, a lot of other conditions can then lead to high blood pressure. Some herbal supplements. So if you're not aware of what you could be doing to contribute to that, lack of sleep is a big factor. Sleep apnea is actually a very treatable, reversible, preventable cause of high blood pressure and must be addressed. Excess body weight is another one. And stress, we all know the effects of stress. It can really kill us.
So what's your overall message of how do we manage our high blood pressure better?
I think there are a few components that we need to be aware of. The #1 is once you have been diagnosed with hypertension, making sure you have a regular follow-up plan with your physician. Knowing your medications, knowing how they work. There are about 6 to 10 different classes of blood pressure medications, and each one works to address a different cause of the high blood pressure. But essentially the root cause is managing the lifestyle factor. So having a clean diet, avoiding excessive salt intake, avoiding stimulants that can raise your blood pressure. Also being aware of medication to medication interactions, that's a big one. And not stopping your medications abruptly. There's a lot of information out there on the side effects of blood pressure medications. Essentially, they're very life-saving and have prevented a lot of other complications. But it's important to work with your doctor to have a good knowledgeable plan about how you need to manage your individual hypertension. That's important.
Absolutely. And of course, you need to check your blood pressure. That's the only way to know for sure. At Oakview Medical Associates, you value lifestyle medicine. For those who don't know, tell us about lifestyle medicine and what makes your practice so special.
So lifestyle medicine is, incorporating a good, healthy diet, nutrition, stress management, sleep management, avoiding any stimulants, tobacco, alcohol that can be detrimental to your health, and just overall addressing the root factors that can keep you healthy and prevent you from having disease. So at Oakview Medical, which I established over 12 years ago, we, a traditional family practice, we see people of all ages, urgent care, we have diagnostics in the office. But what I did was, whenever a patient comes in, we actually take them from whatever they've come in, or sickness to wellness is our goal. And getting the weight down, that's a crucial factor. Obesity, almost half of our United States has obesity, and we need to address that. That's actually a big epidemic. So just addressing it at the root cause, getting the patients doctor to patient trust interaction. And just today, I saw one of my patients who went down from 192 pounds to 150 pounds. I mean, I'm absolutely ecstatic. And that took about 6 months, but she's kept it off and very, very happy, energetic. That just gives me a lot of joy to know that we can make a difference in patients' lives and keep them healthy in the long run.
It's amazing. And you say people really are just taking the time to take better care of themselves these days, which is always good to hear. You can get in contact with Dr. Nita Bajour. Oakview Medical Associates is located at 11 Five Works Plaza Court in Simpsonville. The number is 627-0444. Dr. Nita of Oakview Medical Associates, we look forward to talking to you again really soon.
Thank you. Take care.